What are CPT codes? CPT stands for Common Procedural Terminology and are five-digit numerical codes that describe the activity of a medical practitioner in either evaluating, managing, or performing a procedure or a surgery on a patient. CPT codes are designed to allow all those involved in medicine, including administrators, coders, payers, and researchers, to communicate which services and procedures are performed for use in payment or analysis. CPT codes were originally created under the Johnson administration to standardize medical billing in anticipation of Medicare. The original codes were 4 digits. These codes were updated periodically to capture a broadening landscape of medical procedures and services. In 1978, they were adopted by the precursor to the Center for Medicare and Medicaid Services. CPT became mandatory for health insurance transactions with the adoption of HIPAA in 1996. The influence of Medicare on the healthcare landscape set CPT codes as a standard method to capture and report medical services provided. As of 2016, there were 10,000 listed codes with some 350 additions, deletions, or changes. There are 3 types of codes designated by Category 1, 2, and 3. The first category assigns 5-digit codes to evaluation and management, also known as E&M, surgery, anesthesia, radiology, pathology, and laboratory, and medication administration such as vaccines and chemotherapy. Category 2 are meant to add information to Category 1 E&M codes and are not assigned any relative value. Examples would be specific codes for the performance of a history or physical exam. Category 3 codes are designed for the use with emerging technology that has not yet been assigned a Category 1 code. An example in neurosurgery would be 0334T, sacroiliac joint stabilization. CPT codes may be modified to provide further specificity by appending a 2-digit code to the 5-digit CPT code. These modifiers can describe the help of another surgeon, the same procedure on the patient's opposite side, an incomplete procedure, amongst many others. For example, 61154 describes burr hole for evacuation of subdural hematoma. Adding -50 would be one way to describe that this procedure was carried out bilaterally in the same operative setting. The list of codes is managed by the American Medical Association CPT editorial panel. This body is made up of appointees of specialty medical societies, health insurers, and Medicare. Creation of a new code is initiated by a physician or medical society and requires the submission of information including a description of the new service, clinical vignettes, frequency, and setting. In addition to considering new codes, this panel periodically reviews existing codes for accuracy and relevance. A review may be requested by a physician or stakeholder. Otherwise, all codes are reviewed periodically. The following is a list of references.